now going to just give a little bit of a quick overview on the leading projects and our purpose here. So the purpose is to understand what changes are reliably implemented in the leading projects in home care, to understand the effects of the leading projects on client, provider, and system outcomes. So it's a comprehensive quadruple aim I'll talk about in a second, and to assess the conditions necessary for scale and spread of successful models. So really understanding the context, and that's the realist part that we're going to bring to this evaluation. We're going to detail more about the specific leading projects a little later. Kaylee's going to talk about them. Right now, I'm going to give you a little bit of an overview to the evaluation approach. So first off, explaining realist, it's this idea of what works for whom and in what context, that if you take something like a leading project for home care and you're trying to innovate, how you do it in Chatham-Kent may be quite different from how you do it in downtown Toronto or East Toronto, where you have a different set of resources. People are in different locations. You have different physicians involved, different hospitals, that kind of context, and understanding that and how people then activate the resources within their own areas. The other bit about this is re-aim. So the idea of, can you reach the people you actually intend to do it? We're measuring effectiveness, adoption. So are people able to adopt the changes that are planned? And then what are some of the issues around the actual implementation? And for those people who have been involved, there have been many fits and starts to the actual implementation of the plans in the leading projects, as many shifting sands happen around this place. It's been very active, dynamic, fun-filled environment for doing implementation and evaluation. And the last bit here is about how do we build and lock the good things in that are happening for maintenance and sustaining the models. We are doing this from a Quintuple Aim Framework. So anybody who's seen our work before has seen this many times. Patient experience, health outcomes, cost and provider experience. Today, you are going to see a little flavor of every one of these, including how we bring equity into the evaluation on each of these particular aims. And we do this through measurement. And so we are using different forms of measurement. We are using client surveys and system indicators. We have provider surveys, and you're going to see some of that data today. You're going to see the system indicators, and you're going to see some total cost and some resource utilization. And then we're going to talk about the context. So we're going to put some of the indicators up front, and then Gaia is going to come in and talk about the context in which all of this is happening. Just wanted to I sort of mentioned this a little bit. So how do we do this work? So if working closely with the leading projects, and we have an evaluation working group that we test everything out with, and we do some co-design. I'll highlight one aspect of that later. Sharing with the Integrated Home Care Committee, then moving up to tripartite leadership, and with Ontario Health, Ministry of Health, and Ontario Health at Home, and then sharing with this community, and then broadly, the implementation supports community is another group that we share with, and just many, many other groups that we can get out and share what's happening, how people are doing it, and what we're learning. All of this, when we think of evaluation, we think learning. We don't think evaluation as judgment. We think of evaluation as learning. And so this is a great opportunity in how we do that.